Hello, I'm Dr. Megan Kimberly, and I will be lecturing on Chapter 30, Ethics and the Advanced Practice Nurse. This is a pretty dense chapter, so I do hope that you still read the materials and that this doesn't create a substitute for it. But this lecture is there to augment the material that you're going to be reading on your own. So let's get started. So experience and knowledge alone do not ensure the development of ethical practice. The APRN role does not allow for novice practice. When you enter into the role, you're expected to enter full practice. And that's something that's going to be super overwhelming that you'll find whenever you advance into that role. So what's ethical practice? How you perceive patients, which influences your interaction with those patients. Your ability to accept responsibility for professional decisions, sense of agency. These are all factors that come together to form the ethics of your practice. APNs, and I'll probably use APRN and APNs interchangeably. APNs are frequently at the forefront of advocating for patients seeking primary and or specialty care. And you have to be knowledgeable about the nature of ethical dilemmas and skilled in making ethical decisions. Ethics in nursing is not only concerned with the patient in crises, the patient that comes to you and is like, I need help, but it's the everyday occurrences. It's in the mundane that the ethics in practice get practiced daily. And how do I see examples of this daily? Through my biases in practice. Examples, do I make exceptions for certain patients and not others? Do I hesitate in accepting one patient's narrative over the other? Do I take all complaints with equal weight for each patient, etc.? Those are ways that I see my ethical decision making in the mundane and the daily. Not to say that those are mundane topics, but that is just your typical. It's not always, should we pull the plug? So, on this individual. Symphonology, a big word, so let's break it down. It means a symphony, right? It's in there, of agreement. It is essentially returning autonomy and agency to the patient over their health. It is a system of standards to motivate, determine, and justify actions directed to the pursuit of vital and fundamental goals. Ethics is not convenience, it's not etiquette, and it's not etiquette, and it's not that which brings on a state of self-satisfaction. Symphonology is a practice-based bioethic, and you're going to be hearing the word bioethic a lot. And it's derived from and appropriate to the self-determination of the patient, the purposes of a healthcare setting, and the role of a healthcare professional. Practice-based bioethics is based on interactions between a professional and a patient who relate to each other through agreement and understanding. So it's like living ethics, living ethics. Measuring success is when the patient is able to initiate and sustain on their own. Because isn't that the goal of it all? So rights. Ethical practice does not allow a professional to violate the rights of a patient. A dedication to human values is internal to the ethical nature of the healthcare setting. This presupposes respect for the rights of the patient. The practice of nursing ideally goes beyond respect for rights. However, a professional practice-based ethic must begin with the recognition of a patient's rights. Through this recognition, a nurse provides a bridge between a patient's present condition and a situation and the realization of the values his or her profession promises. So as you go into practice, your ethical competence will grow. with experience, just as your clinical competence and knowledge will grow with time. A person does not graduate from nursing school or enter a nursing graduate program already skilled in bioethical decision making. So don't be hard on yourself here. Just as clinical expertise requires experience and attention, so does ethical expertise. So let's get philosophical here and talk about contemporary ethical theories. I don't know about you guys, but philosophy was one of my favorite core courses that was required as an RN, and I feel like nurse practitioners should have an elective that's really based in this. And since we don't, you're going to get one lecture on it. Wow. So let's go back to that intro to philosophy class, and these are kind of the 4 basic dominant ethical theories. So I'm not sure. So let's start with deontology. It's just following the rules. Formal rules of conduct are mandatory. You must follow them. Intent is what matters. In essence, if you meant well, that's all that matters. Utilitarianism, doing greatest good for the greatest number of people. In practice, this is giving the best care a professional is capable of at all times. Social or cultural relativism is whatever is ethical or unethical is determined by customs, beliefs of the society and culture. And this sounds absurd to me sometimes, and I think about how that really actually is a standard that we live by. Because if one culture says genital mutilation is okay, then under social or cultural relativism, then it is okay. But we could see this in like the civil rights era, where it was the dominant culture for a separate but equal to be the law of the land, and we can see how this is a problem. And so, can you think of good examples of this? I struggle, but there's so many nuances right now that we just take as a standard, and one of that is potentially like it's a hot topic, but maybe police brutality. It's very rare that a police officer gets put on the stand, and we've seen that change lately. But based on our shared understanding of the law and what our culture, how we perceive police and those things, it's very rare that they would come forward. Next one is emotivism. And emotivism is that feeling or emotions are forms of ethical knowledge. This can cause inward focus and away from the patient. So knowledge of all these theories is gained by cultural osmosis and is expressed largely by unverbalized feelings. So none of these theories produces a concern for the person in one's care. They don't always apply. Close attention to the appropriate context and careful analysis based on the nature and purposes of nursing is what defines nursing. Moral courage versus moral distress. It's the ability, the practice of nursing must be moral. Because of economic, political, and social influences, the APN role has expanded and evolved to include more direct and autonomous practice. This progression has brought an increase in responsibility for APNs that demands not only expert in practice, but also an increased understanding and commitment to ethical practice. Moral courage develops because of repeated experiences that move the practitioner beyond the competent practice to one in which there is an integration of ethics. Moral distress occurs when you don't do what you feel is right. This may be feeling pressured to continue prescribing a patient a medication you don't see as appropriate therapy, not having time in your visit to address issues you feel are important, feeling unsure of the diagnosis and prescribing something that you are not sure will help with the problem. These are all examples of what this looks like in practice. So ethics can only be discovered in context. As I've been trying to provide real clinical scenarios of this, the three elements of context to consider are the situation, what is understood by both parties, what each party is aware of. The book gives an example of a nurse discovers that a patient is allergic to a certain medicine and acts accordingly. The fact that he is allergic is one part of the context of the situation. Her discovery of this fact, made by virtue of her past experience and her present thinking processes, becomes one part of her context of knowledge. Her purpose is to protect him. This is made possible by her context of awareness. The context always forms around a purpose, and there are levels of context. Level 1's obvious. What's immediately present? What you see. Example, I am in the exam room. Level 2 is the cognitive level of awareness. I'm providing care. I carry a set of knowledge and power. That patient is seeking my advice. The third level is the highest level and is the essential foresight into the future. It's seeing the big picture, the meta of the situation, and acting accordingly. It is complete integration of bioethics. So how do we flourish as an APRN? Relate professionals and patients internally. Bring them into the same ethical context. Make human values its purpose. Make the healthcare setting purposeful and mutually intelligible. Obligations of the APN include being an agent of our patient, taking actions that a patient cannot take for himself. This includes referrals, connecting with case management, directing them to resources in the community. That is complete integration. Interaction is only possible when all parties in the interaction know what they're doing, why they're doing it, and what they intend to accomplish. All this requires a prior agreement. Decisions can be made and actions can be taken based on the ethical agreement between a professional and our patient. An APN has the resources for appropriately meeting the demands of the context. A professional, through her open declaration that she's a professional, takes on various obligations as part of the nurse-patient agreement. Even APNs who are not practicing in the arena of direct patient care still have the nurse-patient agreement in place. Educators, administrators, and researchers are all ultimately responsible for patients and their well-being. There's lots of agreements that occur in this process. So admin staff agreement, patient nurse agreement, but there's also an agreement with oneself. You've heard the quote by Socrates, an unexamined life is not worth living. One of my favorites. An APN must come to agreement with herself and commitment to be a nurse who directs her actions guided by her awareness of what is needed for her to keep the agreement, embraces her profession. Explicit agreements are what are obviously stated, like it's not required between the nurse and the patient. These actions usually begin immediately, and what will be discovered during the treatment is unpredictable. Implicit agreements are formed immediately. Reflection on herself and her needs gives the nurse a clear idea of the patient's need and value. Although it's not possible for any person to know fully and completely the reality of what's going to occur, it's the nature of human understanding to draw on common experiences and images to form agreements. Bioethical standards. It greatly increases an APN's efficiency if she understands the functions of these characteristics to exercise and to interact with them. The bioethical standards signify these characteristics. Autonomy is the uniqueness of each patient. Freedom is the ability for patients to be self-directed. Objectivity is the ability just to be objective, not bring biases to the table. Beneficence is a natural inclination of a person to act in a way that is beneficial to others and avoid harm. Fidelity is trust, and trust the parties will to adhere to their terms of agreement, stated in the slide before. Virtue is the excellence of a person in performing his or her role as a person. The virtue, for example, the virtue of a farmer is to farm well, and for a nurse to nurse well. So to nurse well, an APN must take direction from patients' autonomy, foster their freedom, form objective patterns of action, exercise this beneficence, understand trust. An APN must be committed to discovery and learning, has strong foundational knowledge and bioethical standards, as this chapter has laid the foundation of, and practice ethical decision making in a context-based model of awareness. So the end of this chapter concludes with a case study in ethics. While I feel this case study is a great example of some of the major ethical decisions we could face as an APN, I do feel it falls short of those everyday dilemmas an APN may face, as I kind of mentioned in the earlier slides. I hope you'll take a moment to review the case study of a dilemma occurring in context in this case. The chapter concludes with everyday, less grand dilemmas and scenarios of bioethical standards in practice as it relates to patients. So take a moment to read these two sentence scenarios that provide examples of autonomy, freedom, objectivity, beneficence, and fidelity. And I also really hope that you take a moment to ponder the bioethical standards that you plan to carry with you into practice. I mean, so often we hear in the news, so-and-so nurse practitioner or so-and-so doctor was caught in an opioid ring where they were just handing out opioids at their clinic, or you might take on patients and read through their records and see a physician that was just prescribing antibiotics for anything and everything, providing opioids for any musculoskeletal complaint without investigating that further. You know, I really hope that when this is all pieced together, you know that each element of what you're learning in this program is going to be so important to creating the outstanding professional that you will become in the future. So I hope you enjoyed this chapter and these topics, and I look forward to reading your future posts.